Hey everybody, this is Dr. Heyer from Holistic Health, and in this week's video we're going to go into more detail about how we use functional nutrition and functional medicine in our office. In our last video we kind of gave an overall big picture of how we do things in the office. And we talked about how we use a questionnaire, blood tests or functional tests, and muscle testing or contact reflex analysis to dig deeper to the underlying causes that are affecting an individual's poor health. Well, this week we want to talk more about the questionnaire. Why is that so important? I know there's a lot of other questionnaires out there, and actually some doctors don't use a questionnaire at all. They just go based on symptomatology. But again, in our office, we're not chasing the symptoms. We want to look at the underlying causes, and this questionnaire helps us start the digging process. Many times it gives us the best answers right away, but sometimes people's issues are multi-layered deep, and this is a great place to start. So, the Nutri-Q Questionnaire is 322 questions that will ask an individual specific things about their health. And what that questionnaire does is it gives us two important pieces of data, two important pieces of information. The first thing it does is gives us a symptom burden graph. And this goes into 16 organ systems in the body and asks specific questions about those. And they include everything from the immune system, the kidney and bladder, the cardio, the male and female systems, the endocrine system, including the thyroid, pituitary, and adrenal. And that's important because a lot of doctors don't really think that the adrenal has anything to do with things like fatigue and other health issues, but the endocrine system is very important. Also goes into the need for vitamins, how a person's body is handling sugar. Now, I'm not going to put diabetes up there because we're not testing for diabetes with this questionnaire, but there are people who have difficulties managing the sugar in their body, and they're either pre-diabetic or they're going in that direction. It also helps us understand the person's need for essential fatty acids. Well, what's that? Well, there's good fats and there's bad fats, and those good fats help the body heal, it gives us energy, and it helps the nervous system regenerate and work properly. Also helps us understand if that person has a need for minerals. And then it goes into the digestive system and helps us understand how the large and small intestine are working or not, and if the liver, the gallbladder, and the upper GI or the stomach are functioning properly. So the nice thing about that is it gives us this graph that we can look at and help explain to the patient where their health levels are at. The second thing it does is it also gives us a symptom burden report or a score. And in this particular case, I like to use simple analogies, like a stoplight, a green light, a yellow light, and a red light. Everybody knows green is good and go. Yellow means you better slow down, something's going to happen. And red obviously means stop. So the cool thing about this type of questionnaire is it gives us a score, and the test that I use, anything between 0 to 100 is what I consider to be in the normal range. I don't expect anyone not to have a sniffle or a hiccup or something like that. So usually my healthier patients are 100 or less. Now, the yellow light, or the second level, those people between 101 and 400 have different degrees of issues. Obviously, somebody who has a score of 350 has more things going on than somebody with a score of 110, but it kind of gives us an idea of, yeah, there's something here, there's something wrong. Their other doctor said everything was normal on their blood tests or the EMG or whatever test they had, but this kind of gives us an idea of, yeah, there is actually something not working right that needs to be investigated further. And then the third phase, or the third step, is red light. Anybody who has a score greater than 400, in my book, definitely should do a detox, or it should at least consider it. And when somebody's that high, or that score is that high, excuse me, when that score is that high, there's a lot of multi-systems issues going on. And for me to apply or recommend or recommend supplements specifically for different organ systems, it's really like kind of chasing our tail. We're chasing symptoms in that case. And what I really need to do is get to the underlying core, clean up, detox, and help the body repair and rebuild. Now, the interesting thing is, you may say, well, how many people score over 400? We literally have had people score in the 700s, the 800s, and even the 900s. The questionnaire only goes up to 1,000. So we've had people who come in very sick, chronically ill, chronic pain, and they score pretty darn high. And usually what we do is start with a detox and get them feeling better and functioning better. and then at that point we can dig deeper into specific tests and recommendations if we have to. So just wanted to share a little bit about how we use the Nutri-Q Questionnaire system in our office. And you know, if you're curious about what your score might be, why don't you shoot us an email or make a comment or give us a phone call at the office, 815-469-7472. If you can read that. We'll put it in the description below as well. We're more than happy to shoot you out a copy of that question, and you can fill it out. No charge, no obligation, but certainly if it would be worth your while to look into if there are some issues that could be helped and resolved. All right, make it a great day.